I'd like to call the Thursday, June 8th, 2023 Health Committee meeting to order. We have 5 members present, so we do have a quorum. We have a consent agenda. Do I have a motion? Motion by Johnston, second by Byrne. Any additions or corrections to anything? If not, all in favor? Aye. Any opposed? Okay, that's passed. We have no members of the public. So first up is departmental matters. Tim Wiley, the nursing home administrator. Welcome.
Hello.
Hi. You have 4 items for action. The first is request approval of an affiliation agreement between CarePax Health Services and McLean County Nursing Home. Motion by Byrne, second by Metzger. You wanna explain that?
Another healthcare education organization wants their staff to do clinicals at the county home.
Okay. And where's CarePax from?
I believe they're from the Springfield area.
Okay. Anybody have any questions?
Is it a private organization or is it affiliated?
Microphone, please.
Director, is this a private organization or is it affiliated with a school or a college at all, as far as you're aware?
Actually, it's a private organization, yeah.
I believe, isn't it behind Walmart in Normal? Yeah,
Okay.
it's a private CNA firm, I believe, isn't it?
Well, I apologize. I just, if
That's
the
okay.
if the director of nursing says we've got CNA classes that want to come in and do clinicals, I take action.
Anyone else?
Yeah.
Okay.
One more question. With the, do we have a program in place to assist with recruiting when we've got all these clinical students that are coming in and working with the home? I'm assuming that's a good source to consider future employees. Do we have a program in place to help with that?
Not officially, it's exposure. When they see a facility that appears to be run well and is odor-free and employees and residents are happy,
Mhm.
it has a way of attracting them.
Okay. All right. All in favor? Aye. Any opposed? All right. That one is approved. Next is request approval of service and business associate agreement with Curatech. I have a motion by Metzger, second by Johnston.
Curatech is another Med B billing supply company, which will, in addition to the Med B supply company that you approved a while back, this company provides wound care products, which are very expensive, and there will be cost savings for the home as a result of their ability to bill Medicare Part B for any Medicare Part B beneficiary who requires wound treatments and dressings.
Any questions? All in favor? Any opposed? Okay, and that one's approved. Request approval of psychiatry, I think that's supposed to be psychiatry, and readmission prevention services agreement with Puzzle Management Group LLC. Motion by Metzger, second by Johnston.
Puzzle was contracted by OSF to help them with their ACO services, with their accountable care organization services. Since we are now a part of the OSF ACO, we just needed this agreement with Puzzle on behalf of OSF's utilization of them to help them where they have their own staffing shortages for the ACO and skilled nursing facility operations.
Any questions? Member Johnston.
Thank you. I just more a point of clarification. I think most people know that I'm no longer with OSF, so I've been abstaining from votes with them, but since I'm no longer with them, I will be voting today. So thank you.
Anybody else? Okay, all in favor? Aye. Any opposed? Okay. And last is request approval of business associate agreement with Carl Port Health LLC. A motion by Metzger, second by Byrne.
This is an agreement that helps us with additional access to their EHR, to their electronic health records. So when we have our residents who go to Carl, when we are getting referrals from Carl, this gives us more robust access to the clinical records of those individuals.
Okay. So is this like an intermediary?
I think it's more of an initiative from Carl relative to their communication of health information.
Okay, anyone else? If not, all in favor? Any opposed? Okay. That is approved. So you have your monthly report?
Yes, just a couple things I would like to highlight. First of all, we're seeing some new benchmarks. 21 is the most admissions that we've had in a month since I've been with the county. And also, our average census greater than 100 for the month is the first time since February of 2018, I believe. And then I know cash on hand has been a concern, so I'll just speak to that real quickly. You can see in the report that we collected over $300,000 on from aging accounts just in the month of April. And to give you a little preview, our cash deposits, that's actual cash that's come in and deposited in the month of April, was over $900,000. And for the month of May, we eclipsed $1 million in cash deposits for as far back as anyone else was able to remember. So those were some exciting moments as far as improving our cash situation, because I know that's been a concern.
Member Metzger.
I just want to make a comment on your customer service and census growth B. That has been something that I know we have been looking at for many months, any couple of years, to begin that referral process from the hospitals, because initially we had not been getting those. So all the work that has been done, I want to compliment your staff, because I know it, and it's people that were there before you, I know also had been working very diligently to make this happen. And so the fruits of their labor and yours are being seen, and we appreciate the efforts. So thank you.
Thank you.
And I do think some of the recommendations from the Blue Ribbon panel have also aided in that part of it too. So, and then following through on the recommendations. So, thank you. Anyone else? Okay. You have domestic services position.
So this position that's listed under information is in reference to a position reclass that will be presented to finance in July. And so we have that on there for information, just so you are aware of it. And I don't know if you want to speak further to that position and the need.
There was a department manager position that after the wage study, I just felt like for our operations that the grade didn't exactly fit the responsibilities of the position, so I was just recommending a reclassification based on that. And how it fit with other department managers, it shouldn't have been graded as high as some, but should have been graded higher than another, and just tried to find more parity.
Additionally, this had been submitted through the budget process for reclassification in 2024, which is the standard process per our budget policy. However, you have had a changeover in staff, and that position will be vacant And so Tim brought it forth to us to be considered for the last half of 2023, and we think it is appropriate at this time. So it'll be coming in July.
Okay, thank you. And next we have the treasurer's report. Ms. McNeil. For the committee members, I just want to say that I had attended Finance Committee last month and asked Ms. McNeil to come to the Health Committee to explain her report that she provides to Finance Committee, and she's had concerns in the past, and I wanted her to address the Health Committee with those concerns. So, thank you.
Good evening, hi. As the chair said, I normally report to finance. And this report is developed to just summarize key areas in which we look at. The report was designed to complement the county's annual financial report and the county's quarterly financial reports the auditor circulates. So typically you wouldn't see a report on one page and like basically just, 6 bullet points. This data comes from pages and pages and pages of general ledger lines. And so, but in any event, it just summarizes key areas in which we look at. It's the very same report that I present to Finance Committee. And so the first area there that you have are the major sources of revenue that the nursing home reports to us on a monthly basis to be accrued to the general ledger. We accrue these to revenue and we offset them to a receivable, okay? And so when the nursing home collects payments, all of those payments then from their residents are applied to that receivable. And then as we travel throughout the year, and the nursing home identifies areas in which they need to adjust to actual because they're not going to receive payment, we reduce that receivable and offset that against revenue. If it's for a prior year, we offset it against an expense line, just to briefly go through that with you. So the first area there are the key sources of revenue for the nursing home, the Medicaid, the private pay, and the Medicare. You can see for the month of April, the total, $834,000. That is the highest number throughout 2023. And again, one more thing is that this report is always going to lag because the nursing home has not reported their May revenue to us yet. We'll get those numbers about mid-June. So we're always going to be lagging about 2 months back. And looking at the revenue, expenses, and transfer, on a monthly basis, for the month of April, there was $855,000 in revenue. That's total revenue. That number includes the items above, but they have other sources of revenue that come in. Not very much, but this is the total revenue. And then the expenses of $857,751. These numbers can change because we work on accrual basis. So, for example, I know one of the things that's not in here is MedLife. Those numbers will change this. Some of the transfers that we do are not in here. So you'll see the numbers fluctuate. It's not like I'm going to come in here for the month of January, February, March, or April and give you a number that's never going to change. It's going to change. So the overall accumulated year-to-date accrued revenue and expenses, currently the expenses show as exceeding the revenue by $57,575 through the month of April. The receivable balance, we started off with $4,144,413. At the end of April, we have $4,386,433. This receivable is high. At the end of 2022, we set aside a reserve for bad debt, worked with the nursing home administrator to set aside a reserve of $2,834,748.57. That's not saying that the receivable is going to be reduced by that amount, but it's very likely that it will be in that neighborhood as Mr. Wiley has time to go through and take a look at some of the prior balances that were on the books before he came into the nursing home, and works with his consultants on doing some of the collection efforts if that's possible. So that has been set aside, and as Mr. Wiley determines that there are areas on the receivable that need to be written off as bad debt, then we will offset that against that receivable balance that you have there of $4,386,000. Cash and investments at the end of April, the nursing home had negative cash of $1,053,703. Basically, right now, the nursing home is borrowing from the general fund to support its operations. The fund equity at the end of April was $1,293,695.
Thank you. Questions, comments? So the numbers that we see in our health committee report are never going to really match the numbers in this report.
That's probably correct.
Right.
At the top of my report, you see the very date that I update these numbers. You also see that this is just Fund 0401. There's another fund that I believe that Tim probably brings into his report. I'm not sure, I've not looked at it in detail, but it's a craft fund. I can certainly bring it in, but at the end of the day, it's not going to make a big difference. And when we're looking at operations, this Fund 0401 is the primary fund that all of the nursing home operations run through.
So can you let the committee know some of the concerns that you've had either recently or in the past about some of the things that you see from your perspective?
Okay. Well, I have been presenting this report to the Finance Committee. Goodness, Catherine, I think it's probably been 8 years or so. And the primary goal is to obviously keep everyone aware of the financial condition. I think that this report has helped put some emphasis on the nursing home and probably seeking some of the guidance of the Blue Ribbon Committee. When I initially started preparing this report, the financial condition of the nursing home was much stronger. And I think that the nursing home is in a good financial position now, even though on the books it doesn't look like it. But Mr. Wiley has certainly made huge efforts and trying to turn things around as far as revenue and expenses go. He's very, very attentive to that. Communicates with me often, and very, very grateful for that. So the purpose also is the nursing home is a proprietary enterprise fund, a business-like fund. Other departments such as mine are part of government, general government, part of the general fund. And but for the nursing home, as the treasurer, the nursing home has separate bank accounts from the county. At the end of the day, we run all of their accounts payable and their payroll through a general clearing account that we have. But if we didn't do that, you would see that we would be in a very difficult position where we would have negative cash in the bank. So even though I show it here, negative cash, it's not like we have bank accounts that are overdrawn. Don't think of it that way. It's just that we have the position, the nursing home is in a position where they're borrowing from what we call pooled cash, basically the general fund, to support operations right now.
Questions, comments? Member Johnston?
Just a quick question. You've been in the role for quite a long time, and you've watched patterns emerge, and the fact that you've been putting this report together for 8 years, and you mentioned that you feel like the nursing home is getting on a stronger footing. If we continue on our current trajectory, what are we kind of looking at? If we're trying to get away from this borrowing from the general fund, is this something that we can hope to get out of in 6 months, a year, at this current trajectory? And I know that's a big ask.
Yeah.
I
yeah.
realize that.
I don't know. I think that's obviously Mr. Wiley's goal, everyone's goal. But, you know, the expenses are what they are. And, you know, you can see that the revenue, the year-to-date revenue is just slightly under the expenses. The expenses exceed it. But, you know, I can tell you there are some expenses that are accrued. And so, you know, the county board, this committee, will have to make decisions on, you know, how they intend to help support the nursing home in the future. If I think it's going to be very difficult for the nursing home to ever rely on just their revenue for operations. They never have. We've always had transfers, always. Since I have been here for 24 years, there have been transfers made to the nursing home fund to supplement and help with their operational expenses. So I don't think we're ever going to get away from those transfers. And I don't know. It's up to the committee and it's up to the county board how they want to, if they want to increase those transfers or look at other ways in which they can fund it. I don't know. So, but obviously it's very close.
Okay.
It's very close.
Okay.
And the high receivable, Mr. Wiley is working on, is working with consultants as well. It's my understanding. So it's good to see.
All right. Thank you.
Anyone else? Member Biles?
So just, I know historically, are we like digging ourselves out of a hole, or are we aspiring to be a bit more of a break even and not borrowing from that general fund moving forward?
I don't feel that I am the right person to give you an opinion on that. I don't want to say either way. I think everyone in this room knows the McLean County Nursing Home is a gem. It is a gem. I'm sure you have all walked the hallways of that nursing home. It is needed in this community, and so we've got to figure out a way to make this work. How it works is yet to be seen, and I think that is, you know, obviously the goal of your committee. But it truly is very beneficial to this community, and it's a beautiful, beautiful place. I mean, I complimented Mr. Wiley a couple months ago how the floors of that facility shine like glass. And, you know, you don't have to go very far to see some other county nursing homes. County nursing homes are kind of becoming extinct. But we have one here in McLean County that we all need to make sure that we do what we can. Even if it doesn't remain under McLean County, just to you know, do what we can. And I will be 100% honest with you. I recently went through a process of vetting out And the word nursing home behind the name, and I know, it's been in existence for years. And the word nursing home has always been associated with it. But it really creates a negative stigma and impression. I mean, people think of a nursing home. Maybe consider changing the name. McLean County Senior Center, just something to get the word nursing home out of it, my opinion. I know you didn't ask for that, just I would ask at it because I've gone through the process of placing a parent. And my mom begged me not to send her to a nursing home. So,
Anyone else? Member Metzger.
Thank you for presenting this to this group, and I know the Finance Committee has been looking at it, and you and I have had conversation, and Chairman Schaefer and I have had conversations throughout for many years about the nursing home's finances, but I would agree with you that this facility, whatever it's called, is desperately needed in this community. We have seen Meadows close, Leroy closed. Many of these facilities have closed, and we are one of very few that continue to provide services to the truly needy of McLean County and outside of McLean County, because there our private pay or our private facilities limit the number of Medicaid and Medicaid patients, and we do not have those caps at this time. But so it is desperately needed, and I would also agree with you. I have gone there many times to provide services, church services to residents, and it is a gem. So I would agree with you there. So we need to do what we can do.
Thank you. Anyone else? Thank you very much for attending and informing the committee about this report. I appreciate it.
you're welcome. Do you want me to bring this report to you on a monthly basis, quarterly basis? How would you like for this to be presented in the future?
What do you think? Quarterly? Quarterly? Quarterly. Would that be okay?
That's fine.
One thing I think that is a bit challenging, and this is just, we're, because the auditor doesn't provide us the quarterly reports, and that's what this works off of, we haven't been receiving them as regularly because of some situations, and I'm not throwing anybody under the bus, please know that, we just haven't. She's been waiting for some numbers to come to make sure they're accurate before she provides us with those quarterly reports. So I'm not sure if it would necessarily be on the quarter. We would want to have, I would think we would, because this is supposed to be an adjunct to those quarterly reports. So I would agree it needs to be quarterly, but it might not be on the quarter, I guess is what I'm saying, because we want to make sure that it's an adjunct to those quarterly reports. She doesn't have anything as detailed as this, but she does have the Fund 0401 in her report. So, and I think you can help contribute to those, or at least the data for those. So I'm fine with a quarterly report. I just don't want us to think that in the July meeting, because June 30th is passed, that we're going to see this immediately, because I'm not sure that, so we might
Yeah.
want to play that.
We wouldn't even have June numbers until about mid, my brain right now, I've been dealing with taxes very heavily. But, for example, right now, I don't have the May numbers. We'll get the May numbers about mid-June, so we'll have the June numbers about mid-July. So it would be like the month of August before I could actually come in here
Yeah.
and give you a snapshot of what things looked like as of June. I would expect that the auditor would be doing she will be doing her report on the quarter because the county's fiscal year runs January 1 through December 31st. I don't know. I guess we could say maybe like this month for sure, and then 3 months from now. And so we're kind of hitting right in between. I'm willing to do anything that you would ask. It's all about sharing information, and I think that when we work together and we put the information out there, just keeps everyone's eyes on it, keeps it on the radar.
Yeah, I think that it'd be better to make sure that that you have the most current report for us. I mean, instead of giving, like, next month, you wouldn't have the second quarter,
Right.
quarter report. But I don't want to wait till September or October to see the report from the second quarter kind of thing. So I think that kind of delaying that and making sure that you have yours done, would be beneficial. So yeah, in between, I think could work.
Maybe because I'm the chair of finance, maybe the chair of health committee, and we could all meet and have a discussion on this. But I don't think anybody is, I think this committee appreciates having the numbers. It's just when they arrive and your role in that, whether it's we see the report and you not attending, I don't know. But I think
Right.
we can work through that, if
Yes,
that's okay.
I agree.
Okay, very
I
good.
agree.
So knowing that we still want to see it, the timing of it, we'll work through that, if
Very
that's
good.
okay with the committee. Is the committee good with that thought?
That's fine.
Okay, thank you.
Committee okay with everything like that? Okay. Thank you very much. Appreciate it.
Thank you.
There's other? Okay.
So I passed out at the beginning of the meeting a one-page document entitled McLean County Nursing Home Revenues and Expenses. This is a snapshot with a graphic. I'm a graphic kind of person. It's easier for me to look at the numbers in this fashion rather than in a table. So the purpose of this was just to share with you what was shared with the Finance Committee last night, and to, in part, answer Member Biles' question. If you note in these years, you can very clearly see that our expenses exceeded our revenues, particularly from 2014 to 2019. In those years in the table, you can show that the net income was in a significantly negative space. And so from those years, they were spending down their reserve balance. And so unfortunately, that reserve balance is now depleted. And so now it is required that the general fund pick up that balance when it goes into the negative. And so as you can also see here, the net income is close to zero for the last, from 2020 till current. Our cash balance is not, but our net income is much closer when you look at our CAFR at the end of the year. And so those lines, the orange and blue lines, are very close together. And at the bottom, you can see that the net income is close to zero. Speaking to the mission of the nursing home, we do want to be in the positive number, but we are not a money-making organization. Government is not here to make money and to compete with the for-profit nursing homes. If we break even and have a little a bit of a cushion for unexpected happenings or capital expenses, that is the position that we would like to be in.
Any questions about that? Okay. But as you can see, that, went south for a while, and Mr. Wiley has really improved the situation and trying to get things back on track. So I think we're in a good spot, I think, so. Next up is Jason Tabb, Juvenile Detention Superintendent.
Good afternoon.
Hi. You have your report?
I do.
Anything you want to say about it?
I believe it's pretty straightforward for the trend so far this year. Nothing seems to stand out to me, so if you have any questions, I'd be happy to answer them.
Any questions for Mr. Tabb? Okay, hearing none, thank you.
Thank you.
Next up is Advanced Correctional Health Care, Jail Medical. So you have your report. Is there anything that you want to say about the report right off? Any comments or?
I haven't really had enough time to get my feet in and understand and really be able to track the trends. I'm seeing some little stuff, but I think it's a little bit too early for me to decide one way or the other. So I want a little bit more time to do some more research, pull the data, compare it, and then make sure the data that I'm collecting is actually correct. And then I think I will be, in a better position to offer more information. But if you have any questions on the actual numbers that were collected, I did my best to not only catch up the data missing for the CQI for ACH from the beginning of the year, but then I think that the month of April, the data should be pretty accurate. I mean, I worked really hard on trying to pull the reports and decipher them. And then the only other thing I can say is I have some training happening this month. I have the EMR people coming in to train the staff to make sure that they're utilizing the EMR right, so that way it's tracking the numbers, so I don't have to go backtrack and go through like daily report sheets and kind of make guesses or try to figure out what the nurses were saying we did in a day. So I think good things coming moving forward. And so just give me a little bit of time to, figure it out. But if you have any questions, let me know, and I'm happy to answer it.
Questions? Yes, go ahead.
Hi, thank you. I really appreciate the amount of detail that you guys have in your report. A couple things did jump out that I just want to ask some questions about. The majority of the numbers here are just kind of raw, like just people. But on one section in the prescriptions dispense, you suddenly flip over to percentages, and I was just curious if there was a reason why.
So that basically is a number that's coming from the CQI that
Okay.
ACH uses. And the jail's ADP kind of changes through daily. So I use the average one throughout the whole month, and then I take that and I use the total number of prescriptions that are prescribed. And so for me, that's kind of the easiest way to give you a running average, just because it's fluctuating so much on a day-to-day basis for medications and inmates.
Okay, yeah, so that was just one that really, the first one that jumped out at me. The other couple of ones that I noticed is that we have 98 patients that are diagnosed with mental health. They have a mental health diagnosis, but only 53 getting care under a psychiatrist. So I was curious, the ones that maybe do they not rise to the level of the psychiatry? Are they on a wait list?
It could be the wait list, but mostly what I'm gonna attribute that to is refusals. So just because we can put that in a diagnosis, and even sometimes they could come in with prescribed medications, which would qualify them for the chronic clinic, the mental health chronic clinic, but then they don't wanna take their medications, and so there's really, you know, not much that, like, we can't force them to take the medications.
Okay. And then down here under inmate services, we did have it looks like nine, I don't know if it's 9 individuals or 9 incidents where there were suicidal ideations or self-harm precautions that were taken. And I'm glad that you were able to keep them there and not needing to transport them to the ER obviously didn't rise to that level. And if you could kind of walk me through what do those procedures look like? What are the steps that you take to take care of the inmates when
So I
that
can
happens?
tell you from nursing, but I'll let her take over after
Okay.
it. So something new that, well, maybe not new, but something maybe that kind of fell by the wayside was the nursing seg rounds. So now, every Monday, Wednesday, Friday, we get a list from Jackie to go over anybody that is like a 23-in-1 or doesn't have access to the tablets, or maybe we're just more concerned with their mental health or even behavior issues. Nursing will go and check on them, and we have a flow sheet, and we ask them all the questions based on if it's a behavior or if it's like mental illness or suicide. Like, the questions are slightly different, but either way, the nurse will go round on them those 3 days, note concerns, put it into the EMR, and then anything really noted that needs to be discussed with inmate services, we'll send a follow-up email. But then this way, for nursing, we are making sure that they have access to a tablet. If they don't have a tablet, do they have access to, the written ones? And then also just kind of educating them on, like, when you do have your 1 hour, this is what you do, put in a sick call or put in for inmate services. And so it's kind of just making sure that, there's more eyes on them, and also that nursing doesn't think that there's something that needs to be addressed that's not being addressed. And then I'll let you.
Okay, so from the mental health side of that, if they're, at least on the suicidal precautions, I have a licensed therapist, a master's level therapist, and a case manager, and me, depending on who is there. Mostly my licensed therapist and my MSW are the ones that do the mental health assessment initially for those things. They will see the person, whether they are flagged because they came in stating something to an officer, police tell us, hey, something's up, or family can call us sometimes and say, I was talking to them and these things were going on. So we will go follow up with the person. Based on the therapist's assessment, we will make the determination of what level of suicide precautions. So that can go anywhere from having all property removed, being in what we call a suicide smock with suicide blanket, and then being on frequent and staggered checks, so regular checks from the officers as well, to maybe you're keeping your uniform, but we're not having you have any sharp objects or the blankets and sheets right now and things like that. It just kind of depends on what level of ideation we're looking at or self-harm thoughts that we're looking at. We then work with nursing if they have medications or anything like that, stay together with that. And then generally, if they're on precautions, they're seen at least twice a day by us, at least. Often more, because if we just are going by and making our own rounds daily, several of us will end up stopping to talk to whoever, and then we communicate with each other about, by the way, I stopped by and they're asking if they can have this, and depending on who we've decided is the primary counselor for them, that's kind of the lead person on that.
And in these kind of cases, are you working on specific therapeutic models, or are you just trying to connect with them and have a more kind of personal relationship connection to try to de-escalate?
Depends on, again,
Okay.
kind of depends on what's going on. So for some people, if they're willing to talk with us, some people come in and they're just not willing to talk with us, which usually we're taking the highest level of precautions at that point and coming back. So in those moments, usually we're trying to build a rapport and figuring out which one of us may have the best shot at connecting at that moment. Otherwise, again, I defer to my two therapists on like what they're seeing and what is working better. And then once we get them past sort of the crisis position, then we move into the counseling and figuring out which level and if they need a psychiatric referral or if they've already have medications or we need an adjustment or anything like that.
Okay. And then as far as the smock jacket, the smock blanket, those are a little different for me. Would those fall under like where we saw there were 6 uses of restraints?
No,
They don't fall under that?
no,
Okay.
no, those would be different, yeah. No, the restraints would usually be, typically we do restraints for aggression to staff or breaking things. Or the self-harm sometimes is if they're like someone's headbanging, we may have to restrain them if we can't talk with them and have them stop and make a safety plan.
Okay.
But generally, no, they're not always tied together, no.
So in the last, for this report, for the April numbers, none of the restraints were for any of the mental health population? Was it all for aggression?
I'm trying to remember who. Go ahead.
Well, and actually, the number for that, that's just like a nursing thing, so that's how many times that the nurses had to complete the restraint checklist.
Okay.
So technically, depending on shift, or if that person went by the first thing and we called the doctor and the doctor allowed the person to stay in it, then, or shifts change, then you would fill out a new form. So I can clarify the next time to make sure that, yeah, because sorry,
The
that,
reason behind it, yeah.
yeah, so that one for us is just how many times that our nurses
Okay.
actually completed one of those forms, because I think that was something that the nurses also weren't maybe educated to do or forgot about doing it when ACH took over. So my regional made sure that we educated on them actually going in and filling out that form. So they track that number, how many times that form is filled out for their CQI. And if you look at the CQI report, you'll see that some of those numbers match perfectly with what's in my report. So what I tried to do is merge the old McLean County report and then ACH's, so that way, I don't know, they gave, I felt like that was a happy medium, so.
Okay. Thank you. That's all my questions.
I have a question. When it, under the detox and withdrawal, do we have MAT or MAR in the jail?
We do have medicines right now that are approved for withdrawal symptoms, but we have MAR starting in July. So we have grant money and other monies that we've been able to obtain and through the Illinois Learning Collaborative, and then I don't remember the name of the other one, so right off the top of my head, the official name of the other opiate money. So our psychiatric prescriber is also certified addictions prescriber. So starting in July, we are increasing her hours. We currently have her about 5 hours a week. We're increasing to 20. So that we'll have her 3 mornings a week. One of those days will be dedicated to MAR services. We've also partnered with Chestnut Health Systems. They are doing a study linking people for opiate use disorder specifically to community MAR providers. So if we start that in the jail or they're just interested in starting it when they leave, it's a warm handoff. They will come and see them, send a ride for them, set them up with the community provider. So we're working with that. We've also are collaborating with Chestnut further so that it's not just opiate use disorder that we can move people in with. So that is coming very soon. We're pretty excited about our ability to do that coming here soon.
Okay, thank you. Anyone else have any questions? And have anything else you'd like to say?
I wasn't exactly sure what I was supposed to have prepared. I will just say that I started in 2009 in inmate services, and it was me and my boss, Melinda. So, and that was all of inmate services. And now we have a licensed therapist, a master's level therapist who's working for a license, a dedicated case manager, reentry specialist, and her entire job is setting people up with those linkages into the community. She's also working towards her CADC at the moment. So we're hoping to have that as well in our team. Our program director has expanded what she's doing for the overall well-being of our incarcerated persons through, she makes special eye bags for our indigent population who would normally not get anything over your basics. So every few weeks, they can get something more. She provides free bras to our women because she just didn't like the bras that were available on commissary, so she orders them on Amazon, and they're given out every few months free of charge to the women just to make sure they have those special things. We are certified mental health first aid trainers, and we're doing that with our incarcerated population as well as our staff so that that's spreading. We've done a class with our incarcerated women and then 3 staff trainings already and setting up more. We've decreased the amount of people. Our numbers for how many people are found unfit to stand trial or not guilty by reason of insanity are increasing, but we're decreasing how many actually have to go to the hospital. We've had increasing numbers that we can work with, treat, and they're found fit, or we're able to help them get stable enough to be released to community services for not guilty by reason of insanity. And I guess coming along with our MAR program, I'm talking with a community partner about hopefully starting an art therapy program in the near future. So I'm talking with her about how we do that. We're working towards consistent therapy dog program with some partners in the community. I think that's it.
Sounds great. And I have to tell you that when I was at the jail for several hours, and I wasn't in jail, I was at the jail for Aegis, and I actually watched Jackie going to different cells, talking to people, you know, and just checking on them. So I can attest that that does happen, you know, and so. Anyone else? Okay. Thank you very much. Appreciate it. Next is Jessica McKnight, Health Department Administrator. Oh.
Hello.
Hi, thank you. Actually, you just have your report. Is there anything on there you want to talk about?
No, I think it's March and April statistics from our programs, and happy to answer any questions if you have them.
Any questions on a report?
I just have one quick question. Every month that I read these reports, I'm overwhelmed by how many programs you guys are running and the level of detail that you're putting into our reports. So thank you very much for that. The third Friday, the classes that you're doing, the parental mental health classes, just a quick question if you know how well, like what's the response and how people are, how they're taking the classes?
I do not, but I can
Okay.
definitely follow up next month.
That would be great. Thank you.
Anyone else? Okay, the other item you have is a health clinic van.
So including a memo with some information about this project that we're working on, hopefully having the van here, if approved, later this year and starting off the project in early 2024. So there's a lot of things being worked out in exactly what this is going to be, but we're excited to further expand the relationships, collaborations that we made really during COVID, getting out into the rural communities and just throughout Bloomington Normal.
Any questions? Okay. The next item I'd like to, if the committee is okay with, I'd like to hold off with for a moment and have E and then number 5 go before closed session. So anybody have any questions on that, problems with that? Okay. Next would be the county administrator.
Thank you. I'll make this very painless. I have no items to present to this committee.
Okay. Other business and communication. Anyone have anything other than our next meeting is July 6th? Okay. All right. So we'll go back to Ms. McKnight, item 2C, closed session. We might not have to. Do we have to?
Yeah.
We have to have discussion, okay.
Oh, we have to have discussion? I mean, if we've read that, I guess I'm not seeing closed session being necessary from my point of view.
Okay, so let me explain, if I might. The item is presented to you for information only on this agenda, and so it will be addressed by vote at a stand-up committee meeting because it's not listed as an action item on this agenda. And therefore, if you would like to have discussion regarding this item, closed session at this committee would be the time to do that. However, you did receive a memo from Jessica under separate cover that explains in detail what is going on with that particular employee. And so if you feel that that is enough information and a closed session is not necessary, it is not required.
Unless Ms. McKnight has any additional information, which I doubt she does, because what we received was pretty comprehensive, I'm comfortable with a stand-up and not having closed session.
All right. So thank you. And with that, I believe we then are adjourned.
Thank you.